How is carpal tunnel syndrome diagnosed? Early diagnosis and treatment are important to avoid permanent damage to the median nerve. A physical examination of the hands, arms, shoulders, and neck can help determine if the patient's complaints are related to daily activities or to an underlying disorder, and can rule out any other painful conditions that mimic carpal tunnel syndrome. The wrist is examined for tenderness, swelling, warmth, and discoloration. Each finger should be tested for sensation, and the muscles of the base of the hand should be examined for the strength and signs of atrophy. Routine laboratory tests and exams and x-rays can reveal diabetes, arthritis, and fractures. Physicians can use specific tests to try to reduce the symptoms of carpal tunnel syndrome. In the tunel test, the doctor taps on or presses on the median nerve at the patient's wrist. The test is positive when tingling in the fingers or the resulting shock-like sensation occurs. The wrist flexion test involves having the patient hold his or her forearms upright by pointing the fingers down and pressing the backs of the hands together. The presence of carpal tunnel syndrome is suggested if one or more symptoms as the tingling or increasing numbness is felt in the fingers within 1 minute. Doctors may also ask patients to try to make movement that brings on the symptoms. Often, it is necessary to confirm the diagnosis by using certain tests. In a nerve conduction study, electrodes are placed on the hand and wrist. Small electrode shocks are applied and the speed which nerves transmit impulses is measured. A fine needle is inserted into a muscle. Electrical activity viewed on a screen can determine the severity of the damage of the median nerve. Ultrasound image can show impaired movement of the median nerve. Magnetic resonance imaging and MRI can show the anatomy of the wrist, but the data has not been especially useful in diagnosing carpal tunnel syndrome. How is carpal tunnel syndrome treated? Treatments for carpal tunnel syndrome should begin as early as possible under a doctor's direction. Underlying causes such as diabetes or arthritis should be treated first. Initial treatment generally involves resting the hand and wrist for at least 2 to 4 weeks, avoiding activities that may worsen symptoms, and the wrist if a splint to avoid further damage from the twisting or bending. If there is inflammation, apply cool cloth of ice that will reduce the swelling. Non-surgical treatments. Drugs. In special circumstances, various drugs can ease the pain and swelling associated with carpal tunnel syndrome. Non-steroid antibiotics, pain relievers, can ease symptoms that have been presented for a short time or have been caused by recent activity. Orally administered water pills can decrease swelling. The drug lidocaine can be injected directly into the wrist or taken by mouth, provided immediately temporary relief to the persons with mild or intermittent symptoms. One way that you should be careful about is when the person with diabetes or those who may be predisposed to diabetes should note that the prolonged use of this type of drug can make it difficult to regulate insulin levels. Some studies show that vitamin B supplements may ease the symptoms of carpal tunnel syndrome. Exercise. Stretching and strengthening exercises can be helpful in people whose symptoms have updated. These exercises may be supervised by a physical therapist who is trained to use exercises to treat the physical impairments, or a therapist who is trained to evaluate people with physical impairments and helping them build skills to improve their health and well-being. Taking care have been benefited for some patients, but their effectiveness remains unproved. An exception is yoga, which has been shown to reduce pain and improve grip strength among patients with carpal tunnel syndrome.